And now the question would be, is immediate loading safe? Now, this is a very important question, and a lot of people might say yes, a lot of people might say no. Let me tell you the answer. The answer is immediate loading is safe if done properly. So what does if done properly mean? And let's go ahead and talk about what does if done properly mean. So if we have to talk about the criteria for immediate loading, what would be the safest criteria for immediate loading? Well, what we did was we divided this into 3 different groups based on 3 different clinical scenarios that you might face. Number 1, a single restoration. Number 2, multiple restorations in the form of a bridge on one side, for instance, and a full arch restoration with what we call the cross arch splinting. If I place a single implant with 45 Newton centimeter and 75 ISQ, it is actually considered safe to load this implant. If I place the implant with 40 Newton centimeter with 70 ISQ and I have multiple implants in a bridge, I can actually load these implants immediately. And lastly, if I place multiple implants with 30 Newton centimeter and 65 ISQ, I can actually load these implants if they are splinted in a full arch type of prosthesis. Which means the more implants I have and the more implants that are splinted, the less the readings have to be. So now you see that we have mentioned both insertion torque and ISQ as fundamental methods to determine if it's actually safe to load these implants or not. But have you really noticed this? Is that on a scale that goes from 1 to 100 ISQ, most of the readings that would allow us to do immediate loading were actually between 65 and 75. And why is that? The reason being is that ISQ and micromobility have what we call a non-linear relationship. So micromobility decreases approximately 50% between 60 and 70 ISQ. This is how much decrease we get in micromobility only from 60 to 70. So this is very important for us to know that we have what we call a non-linear relationship between ISQ and micromobility. But do we always get these numbers in every case? Do I always get 45 Newton centimeter and 75 ISQ? Actually, no. So let me show you this case that we have right here. So in this case, the patient was actually missing 2 lateral incisors. These were congenitally missing incisors. And the treatment plan here was to place 2 implants in these sites, 2 mini implants. So what we started out with is doing a digital oral design. A digital oral design is the concept where we merge all the data of the patient together. We merge the CBCT with the model, with the photograph of the picture, or the picture of the patient. And this was actually before we started out to integrate facial scans as well. So this is what we have here. This is a combination of all the patient's data. And the reason why we do that is because when we do a smile design that will eventually allow us to design the prosthesis, we would like the prosthesis to look good on the patient's face. So we started out with the oval design, and then we started out with a rectangular design. And what we found was maybe the triangular design would be the best looking design on the patient. So based on this information, we're able to actually extract this information, and we're able to design the temporary restoration to look exactly like what we have in the smile design. So this is the planning and the R2Gate software, and as you can see here, we use 2 implants. These are mini implants from Megagen, 3.0 millimeter by 13. This is the temporary restoration that was done prefabricated. This was done before the surgery. So this is how everything looks like intraorally. So we started out with laying a small flap, and then we started out to use our guided drills. And after that, we've used the osseodensification burst to increase the quality of bone in these sites. And then we placed our implants nice and guided. So we placed the implants with only 25 Newton centimeter in this case. In this case, I was really excited to know how the restoration would look like on the patient's face. So we tried it, and obviously everything looked pretty good. But then I remembered that we also need to measure ISQ. And when we measured ISQ, I found that I got only 68 ISQ in this case. So now, if I got only 25 Newton centimeter and 68 ISQ, would that be enough for me to actually load the implants immediately? So when I went back to my loading criteria, I found that what I need for me to actually load the implants immediately, I need 45 Newton centimeter, which I only got 25, and I need 75 ISQ, and I only got 68 in this case. Which means that in this case, it is not actually ideal to load the implants in the same day. And what I did in this case was I actually sutured the patient up and I let the patient go without loading the restorations. But actually, I knew that this would be the right clinical decision because the implants were not ready to be loaded yet.